Welcome back to the next video, and in this video I will be showing you how to apply suction cups on the back. So just like in the previous videos of the shoulder and the neck, you can focus either on stationary cupping or sliding cupping. For today I will use static cups on his low back, and generally low back, mid back area also has tendencies to get very tight due to our postural imbalances. Majority of people have a tendency to curve their spine or flex their spine when they're seated, when they're on the computer or carrying a handheld device. So these muscles get really fatigued, overworked throughout the days. And even if you exercise, some of the athletes that I've treated have low back pain as well. So low back pain can sometimes be due to the tightness of the more superficial muscles. However, when it's due to the deeper muscles, then I definitely suggest going and getting some massage therapy work done, because we can get to the deep muscles like the psoas, even the QL with the suction cups. With that said, I'll apply the static cups first on his low back area. I'll first apply some massage oil, and about a quarter size. Rub between your hands, and then slowly start to apply on the mid and the low back. Since you'll be working with a person at home, if they feel okay with you working on their upper glutes, that area of the body also can get very tight. So don't hesitate to bring the pants lower down if they feel okay with that, so you can work the upper gluteal area, especially gluteus medius, and the attachment of the lateral rotators to the sacrum. For the purposes of this video, we'll keep it PG-13, so I will keep my partner's pants at this height. Well, now that we've applied the oil, I will apply the suction cups. For the low back and the thoracic area, the mid back, please use bigger cups. So I will apply the bigger suction cups. Avoid applying the cups directly over the spine. It is not a pleasurable feeling. So I'll put one right above the pelvis and 2 cups, one on each side of the spine. How's this? Can we do a little more or stay? Okay. You can always do this with your partner seated, and at some point I will ask my partner to stand up and do some forward folds, just to start to invigorate the blood flow in the area a little bit better. Keep in mind to always have some distance between the cups, as I addressed in the previous videos. Too much. All right, so I will apply the cups along either side of the spine bilaterally, meaning on both sides, and you can have them be there for about 10 to 15 minutes. If you see that the cups are starting to change color rapidly and you need to take off the cups sooner, don't hesitate to do that. However, just like anything new, it takes some practice and getting used to feeling and knowing what your partner really needs. I will ask my partner now to stand up so we can actually see how the cups look like when standing. Great, and as you see, it's a perfect presentation. And I will ask him to slowly start to tuck the chin into his chest, rounding the spine. Good, and then roll back up slowly. Good, and have them do this about 10 times. Try not to fold all the way down into a forward fold because some of the cups may start to fall off. Good. And when they're done with their 10, they can simply stop, at which point you will take off the cups from their back. Or if you feel like you need to keep them there for a little while longer, depending if you chose to stay for 10-15 minutes, that's okay too. And this was a stationary cupping method, but just like we did on the shoulder protocol, you can utilize the sliding cupping here as well, just using one cup up and down the entire back. And that is for purposes of timing, or if you, for whatever reason, all your cups are dirty and you have one cup handy, you can utilize one cup. All right, see you in the next video where we'll cover the leg protocol.